So the other ground rule is we have 15 minutes. And so I'm looking at the clock.
If I stand up, you'll know they're at 16.
Right. And to hold myself back, I'm going to read because that'll keep me tight. But to start and to set this up, when we started with this idea, I thought, Tracy, after your 20 years at University of Arizona and at Duke, leading integrative medicine, where your focus is on health and well-being and how to shift paradigm in that direction, with your position at the VA and everything that's been going on there, we needed to have you here. So, yeah, she was actually at the White House this morning at 10:30, and I apparently wasn't to be interviewed. But for the first 2 minutes, tell a little bit about the whole health setup that you've got there.
Great, thank
and
you.
what you're doing.
Thanks, and it's such an honor to be here. So thank you, John. Thank you to the committee, and thank you for allowing me to kind of drop in this afternoon. So it's the concept of whole health, and I'll watch my time too, John, and feel free to slap me if I go too far. But we've kind of coined that phrase, and it seems to work for people. But the fundamental essence of it is, how do we actually, if healthcare were truly about helping people to live their fullest life, if that was the goal of healthcare, what would it look like? How would we design for it? Talk about systems approaches. Like, how would you actually really not just add a little fluff around the corners and a few more tools, but fundamentally change how healthcare works, if that's the goal. And so that's what we have been up to, and it's been an amazing process. Despite the craziness of the system and the bureaucracy and the politics, there's tremendous momentum for this. And I actually think the momentum is largely because the healthcare professionals and the employees want and need this, and they are driving it. So it's starting with their own reflection on their sense of health and wellness and meaning and purpose, and learning and helping them address that in their own life, that then carries that throughout the system. And of course, I could say a whole bunch more, but that is the concept, and it's really rewiring how healthcare works. Disease care is still important. It's still a big piece of it, but it doesn't start with that. It's completely rewiring the whole thing.
Just say, expand a bit. I think one of the things I learned in our interview with this is just that because you're in the VA, you are in this system that includes family and includes getting out of the service, getting homes. I think that's an interesting part of the population health focus.
Yeah, I think that's part of the reason we've been able to make such progress in this model, is that the philosophies are not new to the VA, as you said. I mean, it's been about education and housing and many aspects of one's life, not just healthcare. And yet we were still trying to do it through a medical paradigm. So now we're getting to totally rewire what's the process look like. And we start with peer conversations, and then well-being centers, and then the clinic when you need it. So it's a total rewiring of what healthcare is and how it works.
So there you are inside of this system, which, because it's all of ours, we get to read about it and its issues. My question is, so what do you do yourself to keep your act together, and
so
to put it on a positive? What do you do to maintain your own health and well-being?
Am I blushing? You know what? You know why? Because I thought, when we talked about the interview, I thought of, what I often do and I've always done that's been really core to my self-care is sit my butt on a pillow and breathe. So just kind of letting go of the craziness. So it's not about, for me, it's not about chasing something that I think is going to bring me happiness. It's just about letting go of the stuff that's in the way. And that is an answer. But this week, I had to go to extreme measures. As I was tossing and turning and couldn't sleep, and I'm doing my meditation and I'm doing my imagery, and I'm like, none of this is working. And then I came back, and you actually put in the notes haiku. I know you were kind of joking, but I came back to this, what I think is a haiku. Somebody said to me ages ago, "What if nothing's wrong?" And I thought, right? So sometimes it's like, no matter what stress is around us and what horrific things. I mean, the VA is just political crap, but real is suffering. But what if nothing's wrong? And I find it helpful to just sit with that. Like, it may not be what I want or what I'm expecting or what I think, but what if nothing's wrong? So that was something that came to me this week that I come to when I I'm just turned, and I'm turning, and I'm turning. What if nothing's wrong?
Usually we need like mathematicians with obscure theories to teach us this is the best of all possible worlds.
Yeah.
But, so the next question, and this is going to lead us into a little bit of group work, is while we were pre-interviewing Tracy, she mentioned one specific thing that she did to change culture herself. It actually was quite referenced similarly this morning, but I wonder if you would share that, and then we're going to turn to you all and give you 30 seconds to think about the one thing you could do, and then we'll have some of you toss a few out to the group. So
yeah, so practically, like, what can we do to create that culture in our organizations? And when John asked me that, I said, in the VA, and I am sure this is consistent across at least our nation, if not the globe, there is an expectation that you are plugged in 24/7. I mean, that is the expectation. Like, how unhealthy is that? So I said, the one thing I'm so conscious of is modeling and communicating that is not my expectation. I have the opposite expectation. I don't want to see emails coming in from my team after hours or in the middle of the night. So I have to model that too. So I was saying, and I know this came up earlier, but I said, sometimes on the weekends, I need to do emails. I want to. I put them in draft. I don't send them till Monday. Because if I start doing it, then people think, oh, the boss is doing it. I need to do it. I should be responsive. So being really conscious of, no, we cannot be plugged in. We cannot sustain ourselves and be plugged in 24/7. So that's a small thing, but my team has said that's an impactful thing.
Mm-hmm, mm-hmm. I just love the idea of if you want to write them, you
can
write them.
Just don't send them.
Just don't send them.
Till the work hour.
Because what a message is it? So what I would love you to do for 30 seconds on the clock is to, focus and write down what's the thing that you could do starting tomorrow, personally, that might change culture in some way with the people with whom you work. And then after you take a little time, we'll see if anybody's got some things to share. Now you're on the clock.
I know. That's very helpful, that clock.
Yeah. Actually, we're right on time. We might have some more time. 10 more seconds. A long 30 seconds for you. Okay, then. So, let's see. Did any of you come up with any thoughts about what you might do differently that you might share? Patricia said we have to share them out loud or it doesn't get caught in the record. So, anybody? Yes, Susan?
Just very simple. I thought every day I could either walk over or call someone instead of emailing, at least once a day.
Mm-hmm. Nice. Anyone else? Yeah, Marianne?
I can have compassion towards people who think differently than myself.
Uh-huh. Compassion towards people who think differently than yourself. Uh-huh. Yeah, Patricia?
Don't borrow tomorrow's problems by checking emails late on Sunday evening and losing sleep.
Mm-hmm. Don't borrow tomorrow's problems.
I get asked this question a lot, especially from my dean. What can I do tomorrow to make a difference? And I tell him the same thing I told Francis Collins when I sat next to him. Put a sign outside your door that says, "Come back in 5 minutes, I'm breathing."
Uh-huh. Anyone else? Yep.
I'll give you a different one that I did. When I got to the college where I served last, it was bleak and people were depressed. And spring came and I said, "Where are the flowers?" So we planted flowers. The entire community planted flowers, and 10 years later, the campus is a showplace, and people have invested, donors have invested in beautiful gardens.
Beautiful.
And it sounds silly, but it's not.
It doesn't sound silly at all. Anyone else? Yep.
This is a note of gratitude. I had a leadership, I still have the leadership tip, not had, I still have them. But we had a real difficult endeavor. We were getting through some change and all that. And I sent their spouse or partner a note to thank them for me working with their leaders, because we were spending a lot of time. And they were very, very grateful and really surprised by that note.
Mm-hmm. Oh, that's a nice idea. Anyone else? Because we can all use help if any of you have ideas. Okay. If you think about something while we're finishing here, then butt in at the end. So, do you have any reflections on what you heard?
Only that I love, so often these are simple things. It really just takes the change in the mindset. And that's a takeaway for me, I think, is that it doesn't have to be big and grandiose, but has to be conscious.
Yeah.
So great ideas.
And I like the visual. I mean, what the whole exercise is about was actually about planting flowers, right? How do you plant flowers every day? And then to have the actual flower planting is one of the suggestions. It's quite nice. So
Yes.
now we have the big double question, which it goes back to a couple of dialogues in planning this, and some of it was brought up earlier today, but there's this issue about how much does a leader themselves need to be sort of actively engaged in their own, stubborn issues of becoming well themselves on an ongoing basis to have their slack off and get back on it, but really know that that's who they are as somebody who's involved in a personal wellness process in order to, so let's break them up. Let's do that one first.
Okay.
So how critical is it that leaders be deeply engaged in their own personal health and well-being processes?
Well, I think it's critically important. And what you said, John, that I'd like to underscore that's important is not doing it right, but being engaged in the process.
Right.
Like, I think that's a greater gift to our people to say, hey, I'm not here to model how perfectly my self-care program is, but I am here to model that this is important for all of us, for our personal lives, for our resiliency, and for our work. And so let's be on the journey. And it helps, I think, I have no barriers. Sometimes that's good, or I don't have any filters. Sometimes it's good, sometimes not. But, it's hard. It's a struggle. Everybody knows it. And we share that. And that becomes part of what rejuvenates us.
Mm-hmm. So my thinking about it is that it's actually a necessary but not sufficient part of system change. But you think that it is necessary.
I think it's necessary, and I agree that it's not sufficient. And what do I mean by that? I think that we can model it and speak it, but if people haven't had an experience of it, they haven't felt it, they've only managed their own stress one way or their own eating one way or whatever the issues are, you're not going to shift the culture. So we have to find ways to bake that stuff into the day-to-day practice of the organizations. And so, like, little things that we do, and I'm, again, not perfect, we don't do it every single meeting, but our intention is to start every meeting with a moment of mindfulness. So we start to model, just 60 seconds. Breathe. Take some space between the last thing and this thing. Notice how you're feeling in your body, as an example. We have intentional, let's do random acts of kindness for each other, like the thank you note. Example is a great one. What are we grateful for? We'll do grateful rounds. So baking some of those things into our team processes and our organization helps people go, oh, that's what we're talking about. That's what it feels like. That's how you do it. And then they begin to be able to incorporate it. And the last piece of that, in my opinion, John, is the reflection of that process. So, okay, now we're doing it. We went from talking about it to having the experiences. And then people beginning to notice when we did this with residents, the fascinating thing, we were trying to help people with stress management and OBGYN, pediatrics, and internal medicine residency. And the fascinating thing was when people reflected on, wow, not only did that help my stress, I was better in the OR, or I ran the code better, or my meeting was more productive. And they begin to see the benefits, the personal benefits and the professional benefits. That begins to shift the culture. You know, then it's like, and it becomes self-reinforcing.
Liza said we could have an extra minute. So the tail end of the question is also something I brought up earlier, but so you call this a whole health initiative. You put a positive frame
Yes.
on what you're doing. This is not about limiting stress and burnout.
Correct.
And so talk about how important you
Yeah.
feel like it is, because I know that's
Right.
been
Yeah, we
key to
can-
your whole philosophy, and you went
Yeah.
through a real process to establish this thing.
Yeah, and we can close with that thought, but it's absolutely right. So the phrase that we have come to use in our work, just because it seems to resonate with people, is exploring a sense of mission, aspiration, or purpose. So helping people, again, not what's wrong, what's my chief complaint and what do I need to fix, I'm not happy enough or whatever, but yet, peel away the layers and help people have processes by which we can do that with each other and with our patients around, let's peel back the layers and reconnect with a sense of mission or aspiration or purpose in your life, and then build your health around that. And everything flips. Everything flips. The pain flips. It's a real shift. So I appreciate the chance to talk about that.
And we have to close, but I will close with my first conversation this morning at breakfast was with one of the members who we were talking about health things, and the member said, well, I did what I'm doing for my health because of what I wanted to do with my grandkids, right? And that's the thing, right?
That's it.
It's locating around that. So.
Great. Thanks, John.
Yep.
Thank you, John and Tracy.